Hey, good morning. How are you?
Good. Most of us are here, it seems like, but it looked like it was dark inside.
Oh, really?
Yeah.
Huh. Lights are on up here at night.
Hey, Mike.
Oh. No donuts today.
Yeah.
No donuts today? You ain't getting? You don't got time, he said.
Who's that?
He said he thought Ray was coming and bringing them.
Right, David Donuts is the truck driver school.
Yeah, well, he said he thought Ray was coming today.
And that's fine, it's donuts too.
I could eat.
Shit. I don't have to go to Lafayette today, that's a good thing.
Go where?
Lafayette.
How come?
Because he said we got it, next week, but we can finish me running down there and we can do the whole thing while we
No
do.
donuts today for you, fat boy.
Alright.
No.
Oh, crap. I wouldn't even came. Hey, Dan. How you doing, buddy?
You know where that's from now?
Eat all you want.
You know, you know. Wow, we get out of the too. Stuff on the truck, she didn't go to the kitchen. She told me this. Oh, right there by, is that lot field, by the Hardee's on the avenue?
Oh, okay.
You know, the little shopping
Yeah, they
mall
have
there,
supposed to
that
be
Chinese
like
place
that.
in there, is it? Oh, yeah, yeah, man, it's all you can eat, man. We go to Meridian too, but it ain't all you can eat, but it's good too. It's pretty good. For $7, ain't it for $7? I spent 15 yesterday. I was glad.
I like that.
Mexican too, big cold beer,
Yeah.
big 32 ounce cold beer.
We found
They got
we
that
went to a Mexican restaurant right on the corner
They
of
got
Fountain
food.
Square. It's right on that corner. Best Mexican restaurant I've
Yeah,
ever been in.
yeah.
Right next to the bank.
Yeah.
El San.
That place that we ate at,
It's right down the street from there.
that's good too. Me and Harry, we went back a couple times.
Yeah.
That's pretty good.
I think that place ain't even there no more.
They opened it back up.
Yeah.
They had the best shrimp fried rice I ever tasted.
It's right on the corner.
You know what I like?
It's like a prospect.
Yeah, I love it too.
They love it everything.
You ever had that shrimp
down by
fried
the window.
A-Fouillade?
I don't like it. Yeah.
You don't like it? Like the
Pretty
shrimp.
nice sitting there and
Like the
watching
shrimp
the
A-Fouillade.
circle. The day we were, it was like 65 degrees outside, so everybody was out running around.
What are red lights? Free breakfast. Free breakfast, they're actually charging us at the hotel because of you. You come with like 2 plates stacked about this high. Am I making this up?
Yeah.
No.
Yeah, I already know he can eat. He can eat, man.
Well, I always bring you something, and you said you don't want it, so I gotta eat it.
I didn't ask for nothing. You would be quiet so I could sleep. But all I hear is.
Biscuits and gravy.
Hell, I've been chomping down too.
They're like this.
One of these
Son Davis died. Don's guns.
Well, did he die?
Oh, no.
You saw he died, as long as he
We
did.
didn't saw
He
it.
died today or whatever, or this
I'll
morning.
pass it.
That was a friend of mine's uncle.
Yeah, I knew a couple people that knew him too.
Hey. Oh, no, I don't like to make money, I just like to sell guns.
Yeah.
I tell you, when you rob Don, boy, you gonna get caught, 'cause he put money out there to get you.
He did it twice.
Twice, and he got him too, money.
He beat that murder back in the day too.
Yup, yeah.
He shot some dude in his backyard. The dude was running out of his backyard.
He got back
He
with
shouldn't have shot him, you know what I mean, because the guy was running out of his yard and he shot his ass anyways.
that's Don for you.
Hell yeah, why would you rob a gun store owner? You're asking to die.
Sure glad day Friday.
We both.
Y'all want to walk?
Yeah.
Walk in the morning, what we wanna do, we're in here, go upstairs, go to lunch here,
We gotta do this, MOB, this hospital, right up the street up there.
Man, they had 13 murders already.
Mm-hmm.
This is just crazy, man.
It's cause it's 5 a weekend, that's
Yeah,
why.
they found them two little young dudes a couple blocks of one was 15, one was 16 sitting in the car.
Mm-hmm.
What was the deal on the lawsuit, by the way? 'Cause I was at home,
Yeah.
the news about shooting.
Yeah, it was in cause it was in the 700 block. It was in the 700 block.
Was it down close to the state?
Yeah, yeah. I seen on the bus, I said, that's awful close.
Was it where the school was locked down?
Mm-hmm.
You ever catch that guy that ran over that girl in Raleigh, New York? They caught him?
It didn't run her over, he was in the same car as her and flipped his car, he jumps out, runs and leaves her laying there. Killed her, yeah. They found him, they know who he is, they just haven't found him.
They,
They didn't say.
the woman that killed in, the night before last, and killed that lady, the young girl that was pregnant. And you know he was stupid because he got out and ran, and then the two witnesses in the back seat they got out and ran. You know they would get caught, and the other guy he just stayed. You know he told them.
That's a double murder, but
And he just ran off the left.
Yeah, she was 7 months pregnant.
Well, we got more coming, I don't know where they're at.
James said he'll be a little bit late.
That's correct.
And we about James and Mitch is the only ones missing.
Oh, it's Stephen.
Oh, Stephen.
Harvey.
Yeah, I doubt they come. Oh, yeah.
Don't say nothing, here he comes.
You remember where this place was?
Here's
I
Brian.
just said you was coming.
Come on up.
Is that my jacket?
What's up, bud?
So you're just missing a couple?
You forgot.
Yeah,
Are
a
they
couple.
supposed to be coming?
Yeah, James said he was coming. I don't know about the rest.
You got a check, I gave you one.
You got stolen.
Well, we're gonna go ahead and get
It's stolen.
started.
I told you. That's why you look at the front.
That's right.
So I don't know if you have anybody watching online today, but I think I'm having some technical difficulties getting it up, so.
One time I watched it and it was real bad delay. Couldn't hear every other sentence you could hear.
Really? How long ago was that?
Like the first one, probably first or second one.
Second one? We changed what we were doing last time, so hopefully it, improved it, but now they're not gonna be able to see it today, I don't think, so they may just be listening. But, anyway, alright, so this month we're gonna, and I'll get you the sign-in sheet here. We're gonna talk about first aid and bloodborne pathogens. How long has it been since you guys been through first aid CPR?
CPR not that long ago.
It's been a year. 'Cause we was,
About a year?
yeah,
Probably no longer than that.
yeah.
Yeah.
We was just looking at our cards the other day.
Yeah.
Mine was, due to be re-upped this month.
Oh, is it really?
Yeah.
Well, this isn't certification. I mean, we can't do it in an hour or less, but this is just kind of an overview, just to kind of hit the highlights. So, that's all the intent is. It's not to really turn you into a, approved CPR provider.
We all carry them cards.
Yeah. Everybody, all employees, or just foremen?
Ow, my Elsa! Quick!
So you won't be a professional quite like
Pills!
Maybe somebody should call an ambulance.
You get the pills. Don't worry, I know CPR.
I'll get the pills!
Out with the battery. Out with the battery. This is a lot easier if you just lay back. He's resisting me. Pills. Okay. Pills are good. Pills are good. How you go, big guy? That's better. You want some ketchup and mustard? That helps us. Check, please.
Yeah, you won't quite be as professional as those guys, but we'll give you just a basic overview. So, sprains and strains, that's something that you guys may run into. I'm sure every one of us have had a sprain and strain. Am I right here by saying that? I know I have. So how do you treat a sprain or a strain? And you know, there's a lot of different people that say different things out there. Like I've heard people say, oh, you got to heat it. And others say, no, don't heat it, you ice it. You know, I think there's, you know, listening to doctors, there's two theories on that. One is heat. What's heat make things do? Swell. So with a sprain or strain, you know, what is it? It's a partial muscle tear that's or ligament pull that's caused inflammation, and it's basically smashing the nerves because things are inflamed. So when you think about it, heating it is not really what you want to do. However, heat also makes blood flow increase to an area, which improves healing. It speeds up healing. So really, the right answer, at least this is what I've learned from talking to doctors about this, is early on in the sprain and strain, do not heat it, ice it, to get the swelling to go down. But as the swelling starts to go down, the pain starts to decrease, you switch to heat, and it brings more blood flow to it, which then kind of really pushes it over the hill and speeds it up. So it's almost a kind of a tandem approach, but you start with ice and then you end with heat. But other things you can do, it's really called what's called the Rice method. How you doing? So the Rice method is rest, ice, compression, and elevation. So, you know, easier said than done with some stuff, but rest, I mean, you know, ideally, if you can rest a muscle that's injured, you know, at least the more you rest it, the better it's going to be. I realize a lot of us, you know, you pull something and you're like, I gotta just struggle through this. But if you can figure out ways to try, if it's the left shoulder or whatever, to try to take it easier on that shoulder, you're gonna benefit. It's gonna heal quicker. So the rest part. The ice, like we just talked about, the compression. You can't always, you know, compress every body part. Like a back would be very hard to compress unless you put like an ace bandage around. But like a shoulder, maybe, definitely an ankle or a knee, you can get, you know, compression. You can even use, like I said, an ace bandage would be good. And then elevation, you know, anytime you have your a body part above the heart, you basically reduce the blood flow to it, and it brings the swelling down a little bit. So if you were to, like, let's say you're spraining, you know, to sprain your ankle and you're sitting at lunch, intentionally prop your ankle up. You know what I mean? That'll help a little bit. So the more you can elevate it, the better. So that's what's called the rice method. There's also, you could take a leaf. A leaf's good. Anything with naproxen in it is going to help with inflammation. So ibuprofen and a leaf both have naproxen. Tylenol does not. So if you take Tylenol, it might dull the pain, but it's not going to really help with the swelling. Aleve and ibuprofen will help with the swelling. So that's really the better one to take for sprain or strain. There's also BioFreeze, which is kind of like a modern day Bengay type of thing. It's a topical thing. It helps, but it's temporary. I mean, it's going to help for like an hour or two, and then it's going to wear off, and you're going to have to apply it again. But it doesn't help cure anything. It just kind of masks the symptoms a little bit, makes it easier to work with. So that's a possibility. Okay, burn. So if you have a burn, how do you treat it? Best way to treat it is just pour, coolish water on there, and especially if you're on site, you want to put non-stick pads over it. Don't put stick pads. Don't just put gauze over your burn, because then when you pull it off, you're going to open it up again, right? Burn gel is fine. You could use burn gel. Typically, a lot of people suggest you only use it for like a first degree burn. Do you guys know the difference between first, second, third degree? Yeah. What is it? What's a first degree?
The first degree is like, it's not as deep as bad as the second degree, and then the second degree is 23rd.
There you go. All right.
Yeah, I've been there.
You almost said a key word though. You almost said it's deep, and that's right. That's exactly what it is. It's all about the layers of the skin. So that really determines the severity of the burn. But a first degree burn is almost like a sunburn. I mean, it's a burn, but it's very superficial. It's not real deep. You're not going to have blisters. That's a first degree. Second degree, deeper. You're going to have blisters. It's going to be a lot more painful, take longer to get over. Third degree is like charred skin. I mean, that's bad stuff.
I had third degree.
Did you?
On my hands, both of them.
That's where like you might have, your skin might be white. It could take months, or even depending on what it is, possibly even close to a year.
A year and 7 months.
There you go. Yeah, to get over, and they may even have to do some what's called debriding, which is where they actually scrape your skin off. That's
I know people don't carry it on them, but what about butter? I've always heard butter was good for burns.
I wouldn't do that.
For your grandma in West Virginia.
Yeah, right. I mean, there's a lot of home remedies for things. I mean, the best case scenario, what doctors would tell you or whatever is on a first degree burn, you're free to treat it yourself. Something like a water gel, like a burn gel, is actually designed to treat these burns. It'll cool a burn quickly and basically kind of help draw some of that heat out and treat it well. But anything over a first degree burn, like blisters or whatever, you really should go get it seen. You really should go get it checked out and just make sure.
Kind of like frost.
Because infection could set in, and right. So that would be my advice: is first degree, you're good to treat it on site. If you got blisters or it's bad, I definitely get it seen. So objects in the eye, how do you treat that? If you just look at the real basic stuff, you get a speck of dirt in your eye, you get maybe even some chemical mist in your eye or something, I don't know. You get some cleaner or something. The best thing to do is just flush it with water. Any safety data sheet you look up is going to say flush it for 15 minutes. And all you do is just hold your eye open and flush it with constant running water. You could do that in a water fountain. Something as simple as that. But you want to flush it for a decent amount of time, not just for 30 seconds or whatever. If it doesn't take care of it, you want to go get seen. If it's metal, and boy, I have a hard time thinking of the time. You guys don't grind or anything, right? So probably not going to get metal in your eye, but who knows? Maybe you're around an area that has metal and it's a windy day and it gets in your eye or whatever. That's a little bit even more dangerous, for the fact that it can cause what's called a rust ring. That's what you see right here. So that metal can actually get in your eye and it starts causing a rust ring. And that rust ring, depending on where it is and how bad it gets, could actually impair your vision, cause blindness over time. So metal in the eye, I would definitely go get it seen, and make sure that it's out. Any other thing, probably good flushing it and seeing what happens. Unless it's like an acid. I mean, if it's an acid or a caustic and you got that in your eye, you know, flush it, but get the guy to get seen quick, if it's something like that. And I know you guys do use, you know, some decent chemicals, right? I mean, not necessarily window washing solvent, but those of you who clean like metal around the elevators and stuff like that. I mean, that could be something like that would be more, cause more concern. You probably want to go get them checked out. Has anybody heard about this? Broken tooth, put it in a cup of milk? Never heard that? Now, I don't know how many of you have just a cup of milk sitting around, but if you have milk, actually it will help preserve the tooth. So, if someone were to knock a tooth out for some reason, let's say you got one of your water-fed poles and it comes down and hits Johnny, who's, you know, 30 foot away, knocks his tooth out, you know, get him to the dentist quick. But if you can get some milk and shove it in the milk, it might help preserve that tooth. So
they can't put it back in.
Well, depending on what it is. If it's a broken tooth, like snapped in half, no, they're probably not going to. If it's actually, you know, taken out, they may be able to put a partial post in there and possibly.
Well, then why would you preserve the tooth then? Because the partial post would be a fake tooth, right? I mean, if they put a post in there, they're gonna screw a fake tooth in there, right?
No, they're putting the tooth back.
But how do they do that when the root's this long? I mean, they have to, I mean.
I'm not a dentist, I don't know.
I was just wondering what the milk was for. It saved his tooth to save later, I guess.
There you go. Maybe for the tooth fairy, it looks better, I don't know.
Get some donuts and eat it.
A broken bone. So if someone were to have, you know, be hit by something, fall, let's say someone were to fall and, you know, they were to have, their arms deformed or they're, you know, to the point where they can barely move it, they're really, really hurting. At that point, you want to immobilize the arm. Now, for a sprain or strain, I'll tell you that is not what you want to do. I know a guy who did that and made it worse. Because really with a sprain or strain, a little bit of movement's actually good. You don't want to, you know, stretch it to the point where you're making damage worse, but just getting some mobility in there is not a bad thing. That's like physical therapy. You ever been through that because of a sprain or strain, right? That's what they're doing.
Yeah, but that rep should be around her head.
Around her neck.
But I don't know her, so I'll just
She was our old office manager.
yeah. So sprain or strain you don't want to immobilize, but a possible break you do. You don't want to move a break, right? So in that case, you might use like a triangle band, like a sling, and some of you have those in your first aid kit. I mean, they're pretty long rectangles. You fold them in half. You basically just wrap it underneath and tie it around the back of the neck. And if you have a second one, as you can see here, you know, you could pull one, so you could put one from here around up, and then you could also put one here around. So not only you're supporting it this way, but you're preventing it from coming out. You truly got it up against the body. So that would be.
You make that sound easy, but most of us are more like Dr. Seuss.
Yeah. Well, yeah, it's not always easy. Another easier way to do this, honestly, is you take this and lace it around the back of the neck. That part's easy. But this one, instead of trying to go up around, you could actually go around the torso. So do the second one around, so you're just kind of holding it still. That's probably the easiest way to do it, actually. But yeah, takes a little practice. But. All right, so concussion. If you have somebody who got hit in the head, how do you recognize concussion? What do you do? I got a brief video that talks about concussion. I'm going to throw this computer out. So frustrating.
How to identify symptoms of a concussion. Quickly identifying the symptoms of a concussion after someone has experienced a sudden blow to the head or body is critical. Don't risk your health or the health of a loved one. Learn the signs of a concussion and take immediate action. You will need a quiet place to assess the injury, a doctor, and plenty of rest. Step 1. First, find a quiet place to assess the injury. Has the person lost consciousness at any time after being hit? Know, however, that a person doesn't have to pass out to have a concussion. Step 2. Check to see if the person is experiencing any memory loss. Ask a question about something that happened just before they got hit to test their short-term memory. Short-term memory loss could signify a concussion. Wear helmets and safety equipment when biking, rollerblading, skateboarding, snowboarding, or skiing to protect against concussions. Step 3. Ask the person if they are experiencing problems with blurred vision, dizziness, or difficulty concentrating. If they have any problems focusing, they might have a concussion. Step 4. Watch for the development of physical symptoms like vomiting or headaches in the hours after the person gets hit. Some symptoms of a concussion can develop hours or even days after the traumatic event. Don't take aspirin, ibuprofen, or other non-steroidal anti-inflammatory drugs for a headache if you think there might be a concussion. These medicines can increase the risk of bleeding. Step 5. Watch for signs that the person is having difficulty with coordination or balance after the event. Have them touch their finger to their nose or walk a straight line to test for problems that might indicate a concussion. Step 6. Consult a doctor if you see any symptoms of a concussion in the days after the hit. Rest until all of the symptoms go away and gradually ease back into activities to keep your brain safe. Did you know? Between 2001 and 2005, emergency room doctors in the United States saw over 502,000 children with concussions. Half of those injuries were sports-related. How to identify.
So, with the concussion, recap that for me. I just want to make sure you guys retained it. So, how do you identify somebody with a concussion?
They're confused.
Confused?
Blurry vision.
Blurry vision.
Thrown up.
Getting sick. Memory.
I've had a few back concussions.
I've had multiple concussions.
Yeah, they suck.
Yeah. So, what about pupils? Dilated, right? That's a big one. What were the tests that they said that you could do? Have somebody do?
Finger to the nose.
Yeah, finger to the nose, walk a straight line. Yeah, those types of things. So being able to, notice if does somebody have a concussion or not.
So you ask them to put their finger to the nose?
Right, yeah.
Yeah,
Finger to the nose, hands up to the side, walk a straight line, look at their eyes, ask them, what day is it? Those types of things. Those are things you can do to try to assess if somebody has a concussion or not. from this, they say, hey, I got a headache, you don't wanna really give them aspirin if you think they have a concussion, type of thing. So, that's what you wanna do, as far as diagnosing and checking a concussion. There's really not much, honestly, that can be done for a concussion. I mean, just kinda watch it, you know? I mean, it's
like 2 weeks to get over it.
what it is it's your brain basically takes a jar, and it's a rattling of your brain and it's swelling. So that's what it is, and there's really not anything they can do really. But you definitely during that time don't want to take another blow to the head and make it even worse. They got to be careful. Okay, so a spinal injury, if somebody were to actually maybe have a spinal injury, the key is trying to not move them, unless you absolutely have to. So let's say you get a guy who's walking around on a job site, wanders out in the street, crosses the street to go to his truck, gets hit by a car. I'm just throwing something out there, okay? So hit by a car, and man, he took it in the back, so he kind of knelt down or something, and you're worried about that spinal injury, but he's in the street, and it's like, man, there's traffic, and you know, I don't like. So best thing to do is isolate that area first off. If he's on a sidewalk or somewhere else, I would not move him. I would just basically call 911. If he's in an area where you absolutely have to move him for whatever reason, you know, you got to be absolutely careful with him. You don't want to jar that injury at all. So you don't want to pick him up. You don't want to. I mean, really the best thing to do is if you could have some kind of flat board to just kind of slide under him and pick that board up. But priority one is just isolate the area, make sure, and call 911 and have them come take care of it for you. I mean, that's the best thing to do for somebody who has a serious injury with possibly the spine. Okay, let's say somebody takes a blow to the nose. You know, you drop something, drop a squeegee, and the guy looks up and bang, you know, pops in the nose. How do you stop a nosebleed? Okay, so you want to pinch the nose, right? Not the bone, but the soft part right below the bone. But actually, I'm going to fast forward to past the bleeding, but you want to tilt your head forward. And here's why. If you go back, and we were all taught back, I was taught back, you know, put your head back. I remember when I was a kid, you know, put your head back. The problem is the bleeding goes down and yeah, through the throat, possibly into the airway, and make you choke. You don't want that. The trick is you just want the pressure, right? But you can still do that and lean forward. So you want to lean forward and pinch the nose right below the nasal bone. As far as a cut goes, if somebody had a decent sized cut, you know, I mean, I'm talking a good cut, not just a little nick or whatever, but they're bleeding pretty good. Again, anything above the heart, your blood flow decreases, so that's good. So that's what it shows here. You get that above the heart, elevate it up, pressure, and don't peel. Once this one's saturated, you know, the first towel that you have, hopefully clean pad from your first aid kit. Once that's saturated through, if you need another one, don't peel it off to put another one on. You just remove the clotting that's already happened. You want to just put another clean one right on top of that dirty one and just continue to hold until you got it, right? So that's really what you want to do for bleeding. Cuts and scrapes. A lot of us were told a long time ago, and I know I've been treated this way, is peroxide, right, or alcohol. But they've learned over the years that peroxide or alcohol in an open cut can actually damage the skin. Now, they say soap and water will just clean it just as good. So soap and water is fine. If you have a cut, just wash it off. And I've started doing this for my kids. I got 4 kids, so 2 of them are 4-year-olds, so they're always getting cut and beat up. And so I just wash it with soap and water, make sure it's good and clean. Put some Neosporin on it. That'll help Yeah, it'll help with scarring, but help it heal quicker. And then non-stick pad, Band-Aid or whatever. So that's kind of what you want to do there. I will tell you, here's a lesson learned. When I was with my last company, we had a guy using a pocket knife. Pocket knife slipped and he cut himself. And it was a pretty deep cut. And what he decided to do was immediately put Neosporin on it and Band-Aid. He skipped the cleaning part. What he did was he basically trapped the bacteria that he got from that blade in there, and it caused a serious infection. Yep. So, you don't want to skip the cleaning part. That's the most important part. You gotta make sure you clean it out first before you put that Neosporin on there. So amputation. Let's say you get one of these. If you have an amputation, everybody's counting your fingers. If you get an amputation, wait till the next slide. It's important. What you want to do is, first off, you got to realize whoever that person is that has an amputation, they're probably freaking out. They are possibly to the point of putting themselves into shock, panic. And shock can be deadly in itself. So calm them down. You can't be freaking out, right? You got to be the calm one. Calm them down, reassure them, hey, we're going to get you some treatment. Wherever the cut is, the amputation is. I had a friend in shop class who cut his knuckles off in a plane. It was not good, but went to remove some dust down in a place where he shouldn't have. And it literally, we were in high school. The guy standing on the other side got knuckles all over his shirt. Yeah. But, if you were to actually cut something off, once again, pressure, elevate above the heart, right? Very, very common thing. That's what you want to do.
You put that in ice, right?
Well, not necessarily ice. Ice, think of it this way. It's just like, even though that finger's not attached anymore, it's still skin. Ice will cause frostbite over, that period of time, could damage that skin. So, a bag with, if you have like some cool water.
I mean like your finger that got cut off.
Right.
Yeah, that's what he's saying.
Yeah.
You can still kill the skin on it.
Could still frostbite that skin. I mean, think about it. If it takes, 30 minutes, that'd be like holding your real finger against the ice for 30 minutes, because when they put it back on, it will be frostbitten. So cool water is fine, cool clean water in a bag, but I wouldn't put it on necessarily ice. And get them to the hospital, let them take care of it, but that's what you want to do. Wow.
Holy dang!
What do you do in this case? Impalement.
Take a picture first?
No.
Maybe a smile.
You see, they're cutting that apart. Okay, so if somebody gets impaled by whatever, could be some freak, who knows what scenario, but somebody gets impaled. This could happen at your house, on vacation, doesn't matter. You get impaled, what do you do?
Leave it there. Don't pull it out.
Good. That's exactly right. That's what happens more times than not, is people want to pull it out. The problem is you bleed out. That's your biggest issue. Once you're impaled, think about it, you've got most of the bleeding stopped. You don't want to be out in the middle of nowhere without medical help when you pull that out. Yeah. You want professionals to do it. That's exactly what they're doing here, is they're cutting this off. This guy's going to go to the hospital with this thing in his neck and be on the table when they pull it out so that they can treat him right? So don't remove the object. You just want to wrap around the object wherever that is and call 911 and let them figure it out. But do not pull it out. So spider bites.
Got a couple of those.
Yeah. So there's brown recluse and there's black widow, right? Those are the two poisonous spiders that are indigenous to the United States. If you get bit by a spider, what you want to do is, or let's say you get bit. Let's say you put your hand down into a bush to pull a hose out for your water-fed pole or whatever, and you feel something prick you, and you're thinking, man, what was that? look and see, a lot of times you'll see, you know, 2 holes. You see 2 holes, probably you got bit by a spider, right? So if you can find that spider, find it, look for it, and then see what kind of spider it was. Do you know how to tell what a black widow looks like? Anybody know what black widow looks like? Okay,
They're black with the little red thing on their body, right?
That's right. Okay, so black, and it's a red on the tail. Okay, it's a red. A lot of times looks similar to like an hourglass shape.
Yeah.
Okay, so all black, and I mean jet black, with red dots or hourglass looking thing on the tail. It's a black widow. Okay, a brown recluse. If you see a brown spider, and there's a lot of wood spiders out there that look like them, so they're different, but here there is a way to tell them apart. Brown spider, okay, probably about the size of a quarter or maybe a little bit bigger, but on the, not the tail, but on the thorax, the upper body of it, on its back, you'll see what kind of looks like a violin, okay, so. And it's a darker brown, it's all brown, but right here, you're gonna see something that kind of looks like this. And it's darker than the rest of it.
On its head?
No, not the head, it's on the back, pretty much. So, that right there, you see that darker brown pattern on that upper back, kind of looks like an upside down violin type thing. That's a brown recluse. Okay, so check the spider out if you can. If you see either one of those, get treatment. Don't mess with it, because it can rot your flesh.
I actually had a hole in my leg. I put my whole pinky through it, where it was rotting it.
Weren't you the same one who your garage caught on fire?
Mm-hmm.
You don't have very good luck, man. My gosh. And do you know what it was from?
Brown recluse.
Was it a brown recluse?
Yeah. Well, I let it go for so long because, I don't know, for about 2 weeks. Because when you first got bit, it actually starts out like a pimple.
Yeah.
So you don't really know what it is. You just think it's ingrown net or hair or something like that. And then the redness, that's the poison or whatever. And it started, well, it was actually on my leg, but the redness will actually start racing towards your heart. You know what I mean? And then that's how the doctors caught what it was from the redness. And then they just gave me some antibiotic and it was fine.
Yeah.
Started cleaning myself up.
The quicker they can get you on that antibiotics, the better. And that's what I'm saying, is you don't want to let it get to that point. So
I couldn't walk or nothing.
yeah, it gets nasty. I mean, oh my gosh, there's pictures. I spared you pictures.
Oh yeah, I've seen them.
Oh.
James just gave us
My brother did.
People with thumbs like this big that are split open and
My brother had a big old
disgusting
chunk missing out of his arm right here. From
Yeah, it's gross. So, quicker you can get that checked out and get on antibiotics, the better you are, and head it off before it gets to that point.
That's why I kill them all.
Bee sting. If you have a bee sting, you know, there's the pain, but you know, how do you treat it? I've had people. We had an operator at my last job who had a bee sting and it became infected. So, you know, how do you take the bee sting?
He got stung and he swelled up so bad it scared me to death. When we took him to the hospital, I thought he was playing because he thought he was allergic to him.
It was you?
We took him to the hospital.
You're allergic to bees?
Oh
yeah.
my God, it was ugly. He swore he was like, he had 8 heads.
You have to carry that.
What did you just say?
He looked like he had 8 heads. It was
You look like the elephant man.
It hurt.
Yeah.
They said we got in there when we got in there, he'd have died.
Yeah, I mean, there's people who have serious alert. Did anybody else in here have allergies to bees?
No, I never did. I'm not allergic to them.
Yeah. You know, what's funny is, some people, even though we've been stung, some of us have never had a reaction. We could still be allergic to the bees. I mean, and over time, you could have a reaction later. But, how many times have you been stung in your life?
Well, 10, because I got stung 10 times in one time.
Oh, there you go.
There's another guy here that's allergic to him, but he's on the
Okay.
field.
Okay.
He actually carries insulin around with him in the summertime.
The
where if he
EpiPen.
does
Yeah,
get
Yeah. You got stung 10 times?
Well, what it was, where we was working at, it was a wasp nest and about this big. And we told the guy, leave it alone. We went to call somebody, he hit it. And the wasp came down on me.
Did they sting him?
And, well, I think he got stung twice, but we was all running. So they came from everywhere.
What?
I had
Why would he do that?
We was working at the do one time, and back in the day, we was working on wooden ladders, and we had a guy that wasn't wrapped too tight, and he's on a wooden ladder, and he seen a hornet's nest. And he gonna talk about they were black flies, and he hit it. When they came down, he slid all the way down the wooden ladder. We had to take him to the hospital because splinters and stung.
Oh
All
my
that,
God.
man. It messed him up.
Yeah, that's painful. So with this, you know, in a wound that's a lot smaller, not an open cut where you can get down deep, you could use a peroxide. But one thing you want to do is remove that stinger, because the stinger can still be in there. You want to remove it, and a lot of times it's half, you know, part of it's like sticking out of the skin. You can just take a credit card and scrape it, and it'll pull that stinger out. So you can scrape the stinger out, peroxided ice,
I usually use salt,
that type of thing.
Salt is good, not like my kids and things. I put salt on it and just
Salt and rub it out. That could work too.
Yeah,
So this is what your guy carries with him right here for allergic reactions,
Yeah,
right?
that's what my sister carries.
Yeah, EpiPen. So, and you should. If somebody's that allergic to bees, well, if somebody's that allergic, then they need to have it. But you could have people who have other allergies too, like peanut butter, nuts. You know, those things, food allergies. If somebody's known allergic, you know, that they really should carry an EpiPen with them, because they could have a reaction bad enough to where it takes their life. And you know, I mean, your airway starts to swell and you can't breathe, and it's not good. Is that what happened to you?
That's what happened to me when I got there. My airway was swelling up.
Yeah. And so so what did they do for you? They give you?
They gave me something. They gave me a bunch of shots.
Yeah, that's what that was. You know what that is? It's basically adrenaline. Yeah. So, but yeah, I mean, it kind of gets you going. In fact, I got a funny story just real quick. I got to kind of keep on track here so we don't run over. But I got a good friend. We're good, close with this couple, and one of their kids has serious allergies and has one of these. And they were going out for like a date night, right? So they had this new babysitter come over, and if you don't know about these, they actually give you a trainer with it. So like if you're allergic and they give you one of these because you have food allergies and you need one, they give you a dummy one and a real one. And the dummy one's the trainer, because what you're doing is you're taking this and you're basically jabbing it into your leg, the meat of your leg, and it's a little needle. But you kind of want to get used to what that feels like, right? Not the needle, but how to operate the unit. So Lisa, the girl, is talking to the babysitter before they go out. And she's telling her, okay, so, you know, here's the deal is, you know, Sam's allergic, and if he were to have anything, you just take one, you know, the pin here, and you just want to jab it right like this. And she thought it was the trainer. It was a real EpiPen. And she shot it into herself. She said like her heart immediately started pounding because it's adrenaline. I mean, you know, so she had to go lay down on the bed and just lay there and let it wear off for 30 minutes. But anyway, mild, you know, some kind of mild allergic reaction, you know, something like Benadryl is fine, but something serious, they want to use this. The one thing that you want to know about this is, let's say that guy who's allergic that carries this gets stung by a bee, right? And he gives himself one of those shots. This will help him, should help him get over that hump, but it's only temporary. And there are a lot of cases where people will do this and they feel better, and 30 minutes later they start relapsing again. So if someone has an episode and they give themselves this, you still need to take them in. Make sure that
Yeah, I've seen him use it
they're on the
a
way.
few times actually.
Really?
Yeah.
Because of bee stings, or yeah?
I've seen him use it a couple times, and then I've actually seen him leave a couple times because he got stung by a bee and he didn't have his pen.
Oh yeah.
So he had to go. But he swelled up pretty quick within 20 minutes.
Yeah. Yep. Pretty serious. Can be very serious. So, poisoning.
I remember those stickers in school.
Remember those stickers, Mr. Yuck? Yeah, I remember. Poison help.
Everything.
You know, the one thing I tell you is if it's acidic or corrosive, don't induce vomiting. You're gonna make it cause more damage coming back up. But basically, if somebody drinks let's say you got some kind of cleaner there and it's in a bottle that's not marked, and I've heard this happen before. They think it's water, so they spray it in their mouth, or something stupid like that. Just get them to get treated. There's really not much you can do. Choking. Somebody's choking at lunch. What do? You can give the Heimlich. What's that?
Depends on who it is.
Depends on who it is. You can give the Heimlich. You can give 5 back blows. So basically, get behind him, right between the shoulder blades with an open palm. 5 back blows, and then ab thrust. Basically, you put your thumb right above their belly button. Basically, a fist above the belly button. And you want to just come back with the other arm like that, 5 ab thrusts. So that would be giving the Heimlich, helping somebody choking. Here's an interesting thought about that. What do? Your wife's pregnant. She starts choking, or some lady next to you pregnant in a restaurant and she's choking. The answer is you do chest thrusts. So you're still trying to collapse that airway, but you don't want to damage the baby. So
right across the chest.
So it's so it's right up here. So it's almost like chest compressions a little bit. You want to be a little careful. You don't want to, break the ribs or whatever, but you want to try to get some movement. Because you just think it's just lodged. You're just trying to get air to push it out. So you can still get that done by doing the chest thrust, even above the breastbone there. So, low blood sugar. You know anybody who's diabetic? Oh,
this bubble over here.
Diabetic and allergic to bees, man. You're all right. So diabetic. Are you insulin dependent? Yeah. Okay. So I'm sure there's been times where you realize, I'm a little off and I need to adjust or whatever. What happens to you?
Well, it starts with a headache.
Go to lunch with him, you'll find out.
Go to lunch?
It starts off with a headache, and then I know that I'm dropping.
Okay.
So I go get some sleep.
You start getting a little confused, like trouble processing?
Well, I never let it get that far.
No, okay, good.
He's always like that anyway.
I know.
Yeah. Trouble processing. Irritable. Well, if somebody were to have low blood sugar, give them something sweet. Okay, if they're acting abnormal, or maybe they even tell you, or they're irritable or whatever, give them something with sugar in it, but it needs to be real sugar. Sweet and low, something like that's not going to work. So, sweet food of some sort.
Not too fast, but if you give them the sugar too fast, you cause them to have seizures and all that. You want to slowly give it to them.
Slowly give it to them. Shock. If someone is in shock, what you want to do is put them in what's called a shock position. Basically, lay them down, prop their feet up. Keep the person warm until they can get help. Seizures. If they do have seizures, you basically want, your main thing is you're not going to stop the seizure. You just want to basically make sure that their head's okay. That's the biggest concern, is them hitting their head. So if you can, pad their head, even with your hand is fine, and just try to stabilize them a little bit. Don't ever put your hands near their mouth.
Question for you. I've seen them have people get spoons and put it in their mouth to keep them, I guess, from
From
swallowing
biting
their
their
tongue or something like that. Is that a good thing?
It's fine. Yeah, you could do that. Yeah.
I've seen it.
Don't put your fingers in their mouth. For sure.
You'll start looking like the last clip.
Yeah, that's right. Now, once they've stopped, you put them into what's called recovery position. So you can kind of turn them on their side a little bit and just let them kind of slowly come to. But the main thing is pad their head. Stroke. I'm not even going to try that. I'm going to go right to the video outside of it. So stroke symptoms. If you were to, anybody know what symptoms you notice in somebody that might have stroke?
When a stroke strikes, it spreads like a fire in the brain. The longer it goes undetected, the more damage is done. To spot the signs of a stroke, you have to think and act fast. F. Face. Has their face fallen on one side? Can they smile? A. Arms. Can they raise both arms and keep them there? S. Speech. Is their speech slurred? T. Time. Just like a fire, it's time to call 999 if you see any single one of these signs. The faster you act, the more of the person you save. When stroke strikes, act fast.
Face, arm, speech.
So if he has
If that's what you got out of that, we're in trouble.
if he has one, I'll call 999.
If I gotta count on you to save my life, I'm dead.
Face, so an easy way to do it is smile for them. I mean, if somebody's acting confused or you know, just seems to be having a tough time, whatever, you know, and you're considering, could this be stroke because you're out in the heat for a long period of time, or just a stroke, you know, maybe if you start noticing that they're drooping, have them smile. You could have them stick their tongue out and move it left, move it right. Those are little tests that you can give them. You can have them put their arms up, or even, you know, take my fingers, you know, and squeeze with both, and you can kind of see like, oh yeah, this one's way weaker than the other one. That's one. Or if they're talking and they're slurring speech. So those are all things you can have them do to try to figure out, is this person having a stroke? And you call them, is it 999?
Yeah, for him.
Just for him.
It's kind of fun because we were over at my uncle's house one night and he wasn't feeling good, but his sister was there too, and his mouth was twisted, and he had been and had a stroke. When they took him 2 days later, but he had been having a stroke, and his wife didn't even know that he had a stroke, and they took him to the hospital 3 days later, and that's when he had a stroke. His sister noticed it instantly.
Yeah.
She said she's a dummy because he didn't have a stroke.
Is there anything you haven't done for?
Nothing.
Not much.
Being 65 years old.
Numbness in the face too. If they say, hey, I got my face is numb, that's called a fifth cranial nerve, and it's kind of strange, but that's a telltale sign of stroke. It's not always a stroke, just a numb face. You could have Bell's palsy. You could have other nerve impingements, but it is something that if it's coupled with other things, that could definitely be a stroke. CPR, real quick. If you were trained on CPR, you know, this is basically what they're teaching now is 30 chest compressions, 2 rescue breaths. But they've learned that, you know, the more important thing is the heart pumping more than the air, because you're naturally, think about it, as you're pushing down, you're kind of moving their airway along with their heart a little bit, so you're getting a little bit of air in there as well. Plus the fact that when you're breathing out into their mouth, they're getting more of your exhalation than your air, right? The more of the carbon monoxide or dioxide than they are actually oxygen anyway. So the chest compressions are the more important part. That's why they have you give 30 and then 2. But They're also saying for those who aren't trained in first aid CPR, you could, if you wanted to, you could just give chest compressions only. Chest compressions only. And what they say is 100 beats per minute is how fast you want to do it. So that's like to the beat of staying alive. So that's pretty quick. But that's what they're saying as far as how fast to go on your pace.
Their class says not to do the mouth, right? Not to do the breathing, just do the chest.
Yeah, some people are teaching that now. Just chest compressions.
No, Rose, they are not breathing, and they have no arms or legs.
No, that's not part of it.
Where are they? You know what? If we come across somebody with no arms or legs, do we bother resuscitating them? I mean, what kind of quality of life do we have there?
I would want to live with no legs.
How about no arms? No arms or legs is basically how you exist right now, Kevin. You don't do anything.
Okay, let's get back to it, because you're losing them. Okay, too fast. Everyone, we need to pump at a pace of 100 beats per minute.
Oh, okay. That's hard to keep track. How many is that per hour?
How's that gonna help you?
I will divide and then count to it. Right.
Okay, well, a good trick is to pump to the tune of Staying Alive by the Bee Gees. Do you know that song?
Yes, I do. I love that song. First I was afraid, I was petrified.
No, it's Staying Alive,
That's
Staying
it.
Alive.
You were in the parking lot earlier. That's how I know you. Staying alive, staying alive. Staying alive, staying alive.
You can't tell by the way I use my walk. Woman's man, top. Woman's man, been kicked around since I was born. But it's alright, it's okay. You can look the other way. You
Staying alive, staying alive.
Yeah, okay, you didn't maintain 100 beats per minute, and the ambulance didn't arrive because nobody called 911, so you lost him.
Okay, he's dead. Anyone know what we do next? Anybody? Rose?
I have no idea.
Anyone else?
We buried him.
Wrong. And check for an organ donor card. If you have one, we only have.
Oh, that's out of control. All right, so real quickly, just a refresher. Those of you who have been through first aid CPR, if you're going to treat somebody, remember that blood is infectious, can be infectious, right? So if that person has some kind of disease, whether it be hepatitis, AIDS, syphilis, malaria, it doesn't matter, all kinds of different diseases that people can carry in the blood or in other bodily fluids, including malaria, all these. A lot of gross stuff up there, but any kind of bodily fluid pretty much can carry infectious disease. Now saliva only in some cases, not all, but anyway, just remember that. It can enter through your eyes, your skin, your nose, your mouth, all different ways. You want to treat all kinds of blood as infectious, no matter what. Okay? Know the biohazard symbol also. If you ever work in an area and you see something like that, a bag with that in it or whatever, you want to stay away from that. One way that you can protect yourself is you can coach first aid instead of actually administer it. So if you know the first aid procedures, like let's say somebody is bleeding and you need them to do the elevate your arm and compress with pressure, just coach them through it. Don't do it yourself. They can do it, type of thing. If you have to do it, so the person's unconscious or whatever, also, if anybody is, diabetic or whatever, you want to dispose of the needles properly, cover open wounds. But if you have to give actual treatment to somebody who's bleeding for whatever reason, you want to protect yourself. You should have, hopefully, in all first aid kits anymore that they sell, you've got rubber gloves. You should definitely put those on for sure. If you have to give first mouth to mouth, then you definitely want some kind of barrier.
I just still got one of those.
Well, let me tell you, never given CPR, myself personally. Hope I don't ever have to do it. But my wife's a nurse, she has. I have some good friends that are firefighters who have often, and they'll tell you two things. Number one, this is just the gross truth. When you give chest compressions, when you do it the right way, because you have to really give some pressure, a lot of times you're going to break the ribs, and it's going to get crunchy. When you give mouth to mouth, they may vomit. Now, I'm just telling you the truth. So when you do that, you want a barrier, okay? You want a barrier. You don't want that coming back at you. So that mouth-to-mouth barrier is your best friend if you're going to have to give CPR. When you're done, you want to remove your whatever that's contaminated, put it in the actually you want to dispose of it the right way if it has any kind of blood on it. And what that would be is basically give it to a hospital. That's the right way to do it. Let them dispose of it the right way. And then if you have any kind of, let's say one day you notice that, or you help somebody who's bleeding, this could be personal, okay? This could be you're driving down the road and somebody's in a car accident and you stop to help them. You don't know this person, right? And you had gotten a cut, from helping them, or earlier that day doing something else or whatever, and you notice, well, their blood's on it. You need to go talk to your doctor about that. They can give you hepatitis B vaccination, which isn't a guaranteed cure, but it could help. So there's things that can be done. So if you ever get into that situation, you should definitely get treated if you feel like, man, I could have had contact with the blood and it could infect me. So one last thing, you know how to remove gloves?
Yeah, pull them inside out.
Inside out, right? So pull it inside out, and then you could use this one that's already inside out to grab that one and pull that. That's a good way to do it, but you want to try to keep your hands off the contamination. So what's RICE stand for? Remember that from the very beginning?
Rest, ice,
compression, elevation. Good job. That's it. All right. Where do you tilt your head when you're bleeding? Forward. There you go. Good. Okay. What should you carry if you have severe allergies to food or bees?
EpiPen.
An EpiPen. Good. Okay. What's FAST stand for? No. This is the stroke. Face. Arms. Speech. And time, right? Good. Okay. What should be worn around others with blood? Gloves for sure. Glasses would be ideal too because it can enter through your eyes. All right, good. Tip of the month. Anybody have ICE programmed in your phone? You know what that is?
Emergency contact.
Yep. So if you're in a car accident and you're unconscious and they have no idea who your wife is or what number to call, they open up your contacts, and this is, we're talking about the police department or whatever, that the fire department responding to the scene. You may have, your wife may be Jenny, I don't know, and it's in Jenny. How are they going to know that's your wife? You got a million contacts in there. ICE stands for in case of emergency, and emergency responders are trained to look for that.
My wife's, well, I don't have her in my phone like that, but she's got me in her phone like that.
I've got my wife in my phone like that. It's ICE.
Mine just says babe.
Babe. Well, that might be. They might look for babe.
Well, that's maybe it's mistress. Let's call it. Hey, at least that person knows me.
There you go.
My wife ain't answer the telephone, so I just did.
Some bitches
For real, she don't answer the phone, period. I'm telling you. No, it pisses me off that she do not answer the phone.
Well, ICE is, in case of emergency, it's a good thing to do. Stick that in your phone. All right, any questions, guys? Thanks for your time.
Yep.
Be careful.
See you next one.
Do you guys have any crews right now who are in the elevator?
Dan. Yes. We got anybody that's cleaning the elevator right now?
We were 2 nights ago, but not right now.
Well, I was asking about that. Do you oversee all that work?
Yeah.
Okay. Well, we're rewriting the safety policies, and one of the things I wanted to do is look and see
when you're in that, when you're inside an elevator on during that shaft, it's pretty close. Then your springs. I wanted to look and see if I could maybe get a closer look at that and just see if that's something that could be hazardous to where guys would.
What we were
respirator. Okay. You do wear a respirator?
Oh, yeah.
Okay. All right.
Also,
there was some tasks that Scott and I were talking about, and you were that might have some elevated level noise. I don't know what they were right now. Probably not portable. There it is. But I wanted to do some sound level testing to see if that maybe fire.
Actually, it doesn't bother me. The guy that was at work with like a weekend just put some big like headphones on.
Yeah.
It's fine.
Well, all right. But we're not taking.
But I was gonna say, you
They
can
can
satisfy.
satisfy also, they want you to track test for it. Oh, yeah. Okay. And you guys have it's blocked out for 8 hours.
Yeah.
So I'm gonna see if I can come out and do that.
Yeah. The reason I don't like earplugs is you can't hear what's going on around you.
Yeah, hard.
Yeah, like when we're working and I'm calling this guy, doing stuff. Hey, stop.
Yeah. Do you have access to the safety gap sheets for the chemical that you're using? Can you send that to me?
I can.
Let me give you my card.
Okay.
Do you have that?
No, I don't.
Give that to you. It wasn't there, in fact, it was just a black screen. And I tried to put the, tried to make sure that it said desktop on XSplit.
Are these the instructions? Let's see. Oh, those aren't instructions.
See, look. Wasn't desktop right here?
Yes.
It wasn't here.
Well, you go to add.
I tried.
And then it would be probably other. Let's see. Where I'm gonna have to look at the instructions because I don't remember how we did it.
But on my instructions you gave me, it didn't say add. You
well,
just
what did
said
it say to select?
desktop.
Desktop.
Which was right here. But it's not here. I had nothing there. See, I'm pretty sure it's.
Yeah.
That was.
Go back to that ad again. Let's.
Remove. It's not removing.
It probably won't let you because you're still live.